Welcome to the Maternity Mentor. Today I will be answering the top 5 questions my subscribers have asked. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. All of my top questions have come from full-length videos we have previously published. We have linked all those videos in the description below. Let's jump right into your top 5 questions. Why should I finish my antibiotics? Bacteria are a living organism. As they reproduce, they grow. They cause your infection by overwhelming your immune system and eating up some of your nutrients. So your provider prescribes an antibiotic to help fight the infection. Antibiotics are like poison for the bacteria. It kills them. As the antibiotic starts to work, you will start to feel better or even stop having symptoms altogether. What you need to know is that the bacteria are still there. As long as you continue to take the antibiotics, the bacteria will continue to die off until there are none left. But if you stop taking the antibiotics, the bacteria get a chance to rest and start to reproduce again. So in a week or 2, you are sick again. During that time, the bacteria are not only reproducing, but they are also building a strong defense wall. So the next time you take that antibiotic, it won't work, and an even stronger antibiotic will be needed. This is called antibiotic resistance, and it is a big problem. Taking all of your antibiotics is important because providers don't want to have to use stronger and stronger antibiotics while you are pregnant. Please take all your antibiotics as prescribed and get rid of that infection for good. How do I use cabbage leaves? Cabbage leaves can be an essential part of drying your breast milk supply up. This homeopathic remedy has been used for a very long time. How does it work? Well, actually, nobody really knows for sure. It is believed the chemicals inside the leaves infuse into the breasts, and those chemicals act to inhibit your breasts from making more milk. Cabbage leaves are not going to hurt you, and they won't cause infection. To use them, take a head of cabbage and separate the leaves. Wash and dry the leaves and place them into the fridge. When they are nice and cold, place 1 leaf inside each bra cup. When the leaf is warm and wilted, remove it and throw it away. You can apply cabbage leaves all day long if you want. Cabbage leaves really help to dry up your milk supply quickly. Do I have to treat my UTI with medications? Will a UTI hurt my baby? UTIs can be very dangerous if left untreated. Untreated UTIs can lead to kidney infections and sepsis, both which can be deadly to mom and baby. It's better to treat a UTI early before it progresses to a more severe infection. Providers will usually prescribe antibiotics to treat UTIs after evaluating the risks versus benefits of the medication. The choice of antibiotics is based on the type of infection you have as well as its safety profile. Providers do not want to harm your baby, and they take the decision to prescribe very seriously. Trying to prevent a UTI before it happens can help to avoid needing any antibiotics at all. Prevention starts with drinking lots and lots of fluids, especially water. Use the bathroom regularly, even if you don't feel like going. Don't wait more than 2 hours to urinate. Finally, don't hold your urine. Holding your urine increases your risk of infection. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now on to question number 4. Is it really safe to breastfeed my baby or toddler while pregnant? The answer is yes. Women have been doing this for hundreds of years. There are very few reasons why this practice wouldn't be safe. The biggest thing is to speak to your provider about your decision to continue to breastfeed and look out for signs of preterm labor. Signs of preterm labor can include contractions, leaking, and bleeding. Any of these signs requires you to stop breastfeeding and contact your provider for further instructions. Don't be surprised if your older baby weans themselves during your pregnancy. Around your 6th month, your breast milk tends to revert back to colostrum, and many babies will wean due to the taste and volume of your breast milk. Make sure your older baby is getting plenty of supplementary foods and formula if required. But remember, not all babies need formula, so don't assume you have to start it because you're pregnant. Finally, remember that when your baby is born, your newborn becomes the priority feeder. Your newborn should be offered both breasts prior to feeding your older child for at least the first week of life until the baby has reached birth weight and the pediatrician says baby is doing well. Then you can start feeding the baby from one side per feeding and your older child from the other. Just make sure to switch breasts with each feeding to keep your milk supply up. Do I have to drink peppermint tea to dry up my breast milk, or can I use a different tea? Teas can be used for a variety of purposes, including certain teas being used to dry up breast milk. The number one tea I recommend for using to dry up your breast milk supply is peppermint tea. Peppermint in high doses has been shown to reduce breast milk supply. Sage tea is another remedy that can be used to help dry up your milk supply, though some women do not enjoy the taste of sage tea. Spearmint, oregano, and lemon balm have also been shown to decrease milk supply. Nowadays, there are also convenient combination teas sold in stores and online that combine many of these herbs into one tea bag and take the guesswork out of it for you. You must be careful what teas you choose to drink because there are plenty of teas that will increase your milk supply as well. Fenugreek is a common herb used to increase milk supply and can be found in some teas. Ginger is another common herb that has been shown to increase milk supply. When choosing to drink a tea to dry up milk, I recommend that you have already stopped direct breastfeeding your baby. Additionally, you should be finished pumping breast milk for your baby. Herbs are not well studied in adults, children, and babies. There are some herbs that have been shown to cause gastrointestinal distress for babies, including diarrhea and vomiting, which can be dangerous. It is best to have alternative milk for your baby, including previously pumped breast milk, prior to starting herbal supplements for decreasing your milk supply. I hope this video on our top 5 questions and their answers has helped you. Remember, for more information on each topic, please watch the full-length videos that are linked in the description below. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.